Well, welcome to our SNAP RX webinar, Food is Medicine. My name is Jill Westphal. I'm Communications Manager at Hunger Solutions Minnesota, and will be serving as our host for today's webinar. Just a few housekeeping things before we get started. The phone lines are muted, and I will be controlling that from the control panel on the webinar software. If you're having trouble hearing us right now, please let me know by using the chat box. We will also be using the chat feature to answer questions. Just click the little dialog bubble on the control panel at the top of the webinar screen to open up the chat and ask a question. We will hold questions till the end of the presentation, and we'll try to get to as many of them as possible. Like I said, we are recording this webinar, and it'll be available online within 24 hours. We will email a link out to everyone who registered for today's webinar and attended today's webinar. And please feel free to share the recording with your colleagues who might be interested in learning more about the program. And then we're going to get started. I'm going to introduce Nicole Bailey, our presenter today. Nicole is the SNAP Outreach Coordinator and AmeriCorps Vista at Hunger Solutions Minnesota. She's a passionate public health advocate. Her focus is on addressing issues of food insecurity and other health disparities. She has a bachelor's in community health studies from Portland State University and is currently pursuing a master's of public policy dual degree in the University of Minnesota Twin Cities. So I'm going to go ahead and turn it over to Nicole.
Hi, thank you for joining us today. My name is Nicole Bailey. Here at Hunger Solutions, we bring people together to find real solutions to hunger through partnerships, programs, and public policy, because food is a basic human right. We work statewide with over 300 food shelves, 7 food banks, and leaders in agriculture, healthcare, business, and government, because hunger can only be solved if we all work together. The USDA's definition of food insecurity is lacking the money or resources necessary to have consistent and dependable access to food for all family members. Food insecurity is not having the access either financially or geographically to purchase nutritionally adequate food in a way that the general population does, like from a grocery store. 1 in 10 Minnesotans are food insecure. Poverty is only a problem in the developing world, but in reality, our own backyard. We have pockets of extreme poverty across the country, including right here in Minnesota. While 10% of white households experience hunger, households of color experience hunger rates at up to 21.5%. Schools with majority white students spend $733 per student more than students of majority of color students. Schools that have the majority of white students provide less fruit, or schools that have the majority of colored students provide less fruits and vegetables and low-fat milk options, and are also half as likely to adopt and enforce health standards on vendor foods. The measurement used for determining the poverty line has not been adjusted since 1963, making the method highly inaccurate, thus not actually describing who is in fact living in poverty. This formula was based on the estimate that the average American spends 1/3 of their budget on food. In 2017, it's estimated that the average American household. This is due to the large increase in housing and medical costs. We're still consuming the same amount of food and paying more for it, while also paying more for the rest of everyday life. Yet the poverty level hasn't been adjusted to reflect these changes. These numbers are used to determine eligibility for many of the assistance programs that we will look at later on in the presentation. For example, the federal poverty level for a single individual is just over $12,000 a year. For low-income households living at 100% or below the federal poverty level, an average of $24,000 a year for a family of 4, food insecurity is high. About 1 in 5 low-income households are food insecure, and between 1 and 7 are very food insecure, which means that at times of the year, the food intake of a household member is reduced and their normal eating patterns are disrupted because the household lacks money and other resources for food. This graph shows what percentage of the population are dealing with hunger based on income. Some families living at 185% of the poverty level still face real challenges related to hunger. Now that we know that hunger, in fact, is an issue in Minnesota, why does it matter to you as a healthcare professional? Because of limited resources, individuals in food insecure households, especially the elderly, are forced to choose food over medication, postpone preventative or needed medical care, or forego the foods needed for special medical diets. Patients who struggle with food insecurity also have poor health outcomes. Lack of nutritious food can interfere with the effectiveness of many medications. A 2015 AARP report shows that seniors with inadequate nutrition are 60% more likely to experience depression, 53% more likely to report a heart attack, and 40% more likely to develop congestive heart failure. Patients may have to choose between buying food for themselves and their families or buying the medications they need. Nearly 20 million children face hunger in the U.S. In fiscal year 2015, nearly 20 million, or 44% of all SNAP participants, were children under the age of 18. According to the Feeding America 2017 Child Hunger Fact Sheet, children who are food insecure are more likely to require hospitalization, may be at risk for chronic health conditions such as anemia and asthma, and may have more frequent instances of oral health problems. Also, food insecurity among young children is associated with poor physical quality of life, which may prevent them from fully engaging in daily activities such as school and social interactions with peers. In 2015, the American Academy of Pediatrics published a statement promoting food security for all children, in which the Academy endorsed universal screenings for food insecurity. This recommendation for overall screening is included in the recently published Bright Futures 4th edition. The updated Minnesota Child and Teen Checkup requirements include screening for food insecurity, among other social determinants of health screenings. Many have identified food insecurity as one of their main focuses from their community health needs assessments as well. Screening for food insecurity also meets and accomplishes goals for many social determinant of health screening requirements. Here are a few quotes from individuals who have done food insecurity screenings. They could see the effort is doing something, but a couple of simple questions can make a difference. One staff member said that a patient came back in and told the nurse that they got help because of our food insecurity pilot. That's a quote from one of our staff members in St. Paul, Minnesota. Dozens of children may come into your clinic every year who are regularly affected by hunger. While at first glance they may look no different than any other child, children who are affected by hunger may experience delays in developmental milestones, struggles at school, emotional and behavioral problems, among other challenges. That is a quote from Dr. Neil Bratney, pediatrician in Staples, Minnesota. Now that we have identified that food insecurity is in fact an issue in Minnesota and why it should be important to you, what's the solution? What we propose is using the Hunger Vital Signs 2-question screening tool to identify if somebody is food insecure. The Children's Health Watch, American Academy of Pediatrics, Feeding America, and the Food Resource Action Center all support the accreditation of the Hunger Vital Signs. The Hunger Vital Signs are on the slide in front of you, and they read, within the past 12 months, we worried whether our food would run out before we got more money to buy more, or within the past 12 months, the food we bought just didn't last and we didn't have money to get more. If a patient were to circle often or sometimes for one or both of these questions, they would screen positive for food insecurity. Data was obtained from just over 30,000 caregivers interviewed in hospital-based settings between 1998 and 2005 as part of the Children's Health Watch study. They used the 18-item Household Food Security Survey, which serves currently as the gold standard in the assessment of household food security, and was able to narrow the 18 questions down to 2, which is now called the Hunger Vital Signs screening tool. The Hunger Vital Signs produce a 97% sensitivity and 83% specificity when compared to the 18-question gold standard survey. Sensitivity is the ability to test and correctly identify those with the disease, so a true positive rate, where specificity is the ability to test and correctly identify those without the disease, so a true negative rate. Having high percentages for both makes for a high likelihood of properly identifying individuals who are indeed experiencing hunger. So this is a sensitive subject to talk to patients about, and here are some tips on how you can talk about this subject with patients. 1, screen all patients in all healthcare interactions so nobody feels singled out. Universal screening in inpatient and outpatient settings also prevents the practice team from making possible incorrect assumptions about which patients and families may or may not need food. Decide whether to administer the screening tool in written or verbal form. Some providers prefer administering the screening tool in writing rather than verbally, while others prefer the opportunity to talk directly to patients. Discuss with your team which model would work best for your practice. If the screening tool is administered verbally, consider doing so when the child is not in the room or is distracted by something else. In addition, be respectful of the family's privacy by asking the questions away from other patients and staff. And administer the screening tool in the patient's preferred language. At Hunger Solutions, we have the Hunger Vital Signs available in multiple languages, as well as our consent form in Spanish, Somali, and Hmong. Here's an example of a good way to explain why you're asking these questions of a patient. I'm seeing so many people that are having a hard time affording food, so I'm asking all of my patients some questions about this. Please let me know if either of these statements is true for you and your family. Inform the parent that assistance is available, and most people across the country need assistance at some point in their life. This will help take away the stigma of using emergency food assistance and federal nutrition programs. Use physical environment cues like posters or brochures that address food insecurity or nutrition assistance programs, which helps normalize the participation. To see the full list of suggested approaches, as well as a comprehensive toolkit on food insecurity screening, please see this wonderful resource from the American Academy of Pediatrics. I have included the link on the slide. So, what is Hunger Solutions SNAP-Rx? SNAP-Rx uses the Hunger Vital Signs screening tool to identify if a patient in a healthcare setting is experiencing food insecurity, and then implements a process to get them connected with food resources. This is a simplified version of the SNAP-Rx workflow. We will discuss in more detail about the logistics of the helpline in a moment, but here are the basics of how it works. A patient visits their healthcare provider for a routine care visit. Healthcare provider identifies food insecure patients using the 2-question survey. Healthcare providers connects patients with Hunger Solutions Minnesota's Food HelpLine. And the Minnesota Food HelpLine connects your patient with SNAP, food shelves, and other food resources. So here at Hunger Solutions, we ran a pilot, a 6-month screen and intervene pilot with 3 health partner clinics, one in an urban setting, one in an ex-urban setting, and one in a rural setting. Through the pilot, we found that 59% of the patients who were screening positive for food insecurity and were referred to us were already enrolled in SNAP, meaning that they were already participating in the nation's largest food assistance program, and they were still suffering from food insecurity. 23% of those who were not already enrolled in SNAP were screened, and we found that they actually qualified for the program, and 18% were screened and did not qualify. This means that 18% of the people who screened positive for food insecurity needed help with food assistance, but were just over the income limit to qualify for SNAP. This is an example of what a workflow would look like within your clinic. This is the one we use for health partners. I know this is a lot to look at on one slide, but this is essentially what a workflow would look like while integrating the 2-question screening tool. So here are a few stories from our helpline calls conducted as part of our pilot program. A Midway Clinic patient submitted the necessary paperwork to her county office with guidance from the helpline. She is now enrolled in SNAP. She quotes, "I have food now, so that's good. Thank you for helping me enroll in the program." A patient was concerned that the application was too complicated for him to fill out. The helpline referred him to a SNAP outreach specialist to help him through the application. He quotes, If it hadn't been for the follow-up call or for the option to work with a specialist one-on-one, there's a good chance that the patient likely would not have applied for SNAP. So the good news is you can participate in SNAP-RX also. There are a few different ways that SNAP-RX can be integrated into your clinic, although we highly recommend the champion level. Even if the only thing your clinic does is to place materials in the waiting room, it helps to normalize the conversation around hunger. Here are some examples of what our forms could look like for your clinic setting. The one on the left is a tear-off option so the patient can take our information with them. And the one on the right is our HIPAA-compliant release form. The only information that we really need is a first name, phone number, language preference, time of day to call, and their signature. The program is flexible and can be adjusted to fit your specific workflow and needs. A survey administered at the end of our pilot showed support for expanding the program as well as suggestions for adjusting the flow. Both interviewees and survey respondents agreed that the 2 screening questions needed to be more fully automated and integrated into the patient workflow. All interviewees noted hesitation with the consent form for referral. One observed that using a model of verbal agreement similar to what you use for tobacco cessation might improve participation. It was recommended by many staff members to embed the questions into existing systems to streamline the process and make the referral simpler. We also have educational material that can be provided to your patients. The goal is to normalize this type of conversation, just as it's normal to talk about wearing your seatbelt or feeling safe in your home. It's also possible for us to co-brand these materials for you. Along with the co-brand, we also can include the information to the closest food shelf on the back, as well as the phone number, hour of operations, and the address. So, what is the Minnesota Food HelpLine? Minnesota Food HelpLine increases knowledge and availability of food resources, bridging gaps in food insecurity across Minnesota. They do this through preliminary screening for SNAP, medical assistance, energy assistance, WIC, school meal programs, child care assistance, earned income tax credit, and working family credit. And they also provide SNAP application assistance. We also provide referrals for in-person application assistance, food shelves, hot meal sites, farmers markets, discount grocery programs, and nutritional education programs. Through SNAP-RX, Abby or Rachel will be reaching out to the patient. They will then ask them a few simple questions, and through our language translation services, we're able to communicate with your caller in any language they prefer. We provide them with county-specific SNAP application information in which they will be pre-screened to determine if they're likely eligible. We also do a comprehensive bridge to benefits screening, which will screen the caller for other assistance programs outside of food resources. If you are currently a bridge to benefits partner or are interested in becoming a partner, there is an option to refer Hunger Solutions Minnesota patients through their double-blind referral tool on their website. After we complete the preliminary screening, we can then refer callers to other food resources like food shelves, hot meal locations, discount grocery programs. For SNAP case-related questions, callers are given the resources needed to have their questions answered. If there is a case-related issue, callers are provided with the necessary tools to allow Rachel or Abby to advocate on the caller's behalf. This is what our Get Help interactive map looks like, which can be accessed through the link provided or by clicking the Find Help tab on our website. Some of the features you will see, you can just put your zip code in the box and click which resources you would like to look at and how many you would like to look at. I have it set at 5 right now. I believe it goes all the way up to 25. And it will pop up all of those resources within that category right there for you. Here are some of the resources that we are able to provide callers. We pre-screen all callers for SNAP, which is formerly known as food stamps. Eligible households will have an electronic benefits transfer card to use to purchase foods through SNAP. We also work with 7 food banks and over 300 TSAP-funded food shelves and many meal programs in the state of Minnesota. TSAP is the Emergency Food Assistance Program and is federally funded and supplies commodity foods through the food banks to food shelves. Most of the items provided are staple foods. Here are a few other programs that are part of the emergency food system. Meals on Wheels, WIC, which stands for Women, Infant, and Children, Fare for All, Market Bucks, and Twin Cities Mobile Market. Well, thank you for your time and for listening to our SNAP-RX presentation. We're excited here at Hunger Solutions to expand our work with new partnerships every day, and I look forward to hearing from many of you in the future.
All right, thanks, Nicole. I'm going to pull up contact information. If you guys have additional questions or want more information about how to participate in SNAP-RX, Nicole's contact information is there toward the bottom of the slide, or you can always call the Minnesota Food HelpLine at 1-888-711-1151 to ask questions or get connected to food resources for your patients. So I'm going to go ahead and take a look at some of the questions that were asked. All right. I've got a question about the screening questions and protocol. Do we have to ask the screening questions to all of our patients? It just seems like it's a bit of a waste of time to ask patients these questions who already appear to be eating well. Nicole?
Yeah, so we are really flexible with the way that process works, but to help reduce stigma within a clinic setting, it really does help to screen everybody. We also found through our pilot program that it creates more work for the staff if you're only screening some of your patients, because then they have an extra step of trying to figure out if they should or shouldn't be getting the form, or if the rooming nurse should or shouldn't be asking the question, where it really kind of streamlines everything to just screen everybody. It's also really hard to look at an individual and know if there's somebody who might need help. So screening everybody is recommended, but we are pretty flexible with how we can format the program.
Okay. So we're hearing sounds great. How do we get started? What does SNAP-RX cost? What's the next step if our clinic is interested in participating?
Yeah, the best way to get started would be to just look at that contact slide and send me an email, and we can set up a phone call or an email chain. One of my favorite parts about this program is it's actually free to clinics to use. We've been able to develop it at no cost, and the Minnesota Food HelpLine is already an existing program that is already funded through a state SNAP outreach grant. So it's no cost to you, and we don't really foresee there being much of a cost to it in the future.
How long does it typically take to get a customer or a patient signed up on the SNAP program?
The way it works in the state of Minnesota is from the day that the county receives the SNAP application, they have 30 days to let that person know whether they've been accepted or declined from the program. So it could go anywhere from 30 to 45-ish days before they would actually receive their benefits. If we actually have all the information at the helpline, there are many counties where we know that if you just go into the office that day, a lot of times you can leave that day with your SNAP card with your benefits to go use at the grocery store.
Okay. Do we have any other questions? Be sure to put those in the chat box. We'll be happy to answer them. Again, if something comes up as you're reviewing this with your team or thinking about getting started, don't hesitate to reach out to Nicole. Her contact info is on the screen right now, or the helpline is always able to help connect you guys with the resources you need. Here's another one. Are you able to come out to healthcare sites and do presentations on the program? Are other safe community nurses able to implement the program?
Absolutely. One of my favorite things to do is travel across the state of Minnesota. So anybody who would like me to come out and do an in-person presentation, I would be more than happy to do that.
Do you have any other questions? All right, seeing none, we're going to go ahead and wrap up. Once again, Nicole's contact info is on the slide. We will be posting the recording online and emailing out a link to the recorded presentation and the slides so you can take a look and peruse those at your leisure within the next 24 hours. So thank you guys all for taking the time to join us today on the webinar.